Okay, so next muscle length test we're going to do is for hamstrings. So this is going to be to test the hamstring length and compare right to left. So Glenn, what would we do for that one?
There's two ways of setting this up. What I have traditionally done is bring the hip into 90 degrees of flexion and then just create a little bit of stability here, and then just ask Patrick to straighten his leg for me to extend. And you just want to be conscious that he doesn't push that way with his thigh and come out at 90 degrees. Yeah, so that's the sort of standard setup. And what you're looking for, if we bring you back down again, is between 0 to 20 degrees from full extension of the knee. Yeah, so Patrick's well within normal range there. What I've been playing around with recently though is if you link your arms under here for me, Patrick, that's it, and just hold them and standardise it in this way. Yeah, so now extend for me. Now you might be a few degrees off of full, but it's easy to reproduce it, and you know that as he locks his hands in, it's going to be the same every time you test it. So in some ways I think this is a more reliable way of doing it, and you can see he's more or less at 90 degrees of the hip, isn't he? But his arm length's never going to change really, so every time we do this test as an objective marker. Patrick's really good, he's not pushing down against me too much. I'm sure you've had it yourself sometimes. When they try to extend here, you're almost having a bit of a battle with the leg to try and keep it into 90 degrees. So this takes that out for me, and then I can feel the resistance at the end, maybe add a little bit more, and have a look at the lumbar spine. It just frees me up to do a little bit more to make sure he's not really going into posterior pelvic tilt and all that kind of stuff
Could you do that passively as well?
Yeah. So that's the active knee extension, so that's him actually doing it. And the other way you can do it is again just get him to link there and just passively take it up yourself as well. If you wanted to incorporate that as a bit of a treatment, you might come underneath with the shoulder, give a little bit more. Yeah, you can do your hold relax stuff, which we'll go through in the treatment section. Yeah,
and I like that because you can have a little feel as well, end feel. Often when it's when it's really tight through there, or if there's a lot of neural type issues, you're going to get a little bit more kind of almost shaking of the leg a lot of the time when you go into that position. So it's just quite nice to be able to feel that. But yeah,
you can play around with the ankle as well if you're thinking neural as well.
Perfect.